in the country. Amongst other points he made, he directed traditional healers to stop treating people and instead direct them towards Western conventional medical facilities. In his address, the president called them witch doctors.
Witch doctors, traditional healers, and herbalists should not accept any sick people now. Suspend whatever you are doing. Advise them to call health workers for safe transfer to hospitals.
In many parts of the continent, traditional healers are the ones people turn to first if they are unwell. But in the case of Ebola, it is possible that this can cause a further spread of the disease. Well, to discuss this aspect of Uganda's response, I'm joined by Information Minister Chris Baryomunsi, who's himself a medical doctor and epidemiologist. Mr. Information Minister, what's the issue with traditional healers and herbalists when it comes to Ebola?
Well, thank you very much. As you heard our president communicating, we got cases of Ebola in a few districts in central Uganda, and some of the cases first went to traditional healers, the herbalists, and later on, by the time they got into contact with the Western medicine system, it was too late. And that's why the president was directing that these herbalists and the traditional healers should cooperate. And once patients go to them, particularly those who present with the fever and headache and other symptoms of related to Ebola, they should be immediately referred to the health facilities. So we are mobilizing these traditional health practitioners to support the response to Ebola so that we can contain this Ebola outbreak.
Do you have fears that people turning to
outbreak?
Do you have fears that people turning to traditional healers further worsen the outbreak in Uganda, the Ebola outbreak?
Yes, absolutely. We have mounted a very strong response, and we are communicating to the public for people to seek health care from the formal health care system. But we also know in these rural areas, some people first report to traditional healers. And therefore, if we allow them to continue treating people who have signs and symptoms of Ebola, it may worsen the situation, and the traditional healers are cooperating.
In Sierra Leone, during the Ebola outbreak in 2014 to 2016, the government paid healers to compensate them for loss of income because they were not allowed to treat patients. And this helped them to support the government's efforts. Do you have plans to do something like this?
No, for now we don't have plans. First of all, the outbreak is in a small area. We are not talking about the whole country called Uganda. We are in around 3 districts in one localized community, and we have mounted a huge response to see that we do not have Ebola spreading to the other parts of the country. And the traditional healers, mainly in that local community, they are not very many, and they have not yet demanded that we compensate them. So we do not expect them to raise those demands, and we are not going to compensate them.
Now, to talk about the population at large, when you have outbreaks like Ebola, often governments need to get the communities, the population to come on board to buy the messages that the government is sending out. What can the government of Uganda do to increase the trust of the people in the Ebola response?
Yes, first of all, we have a communication team, which I am coordinating as the Minister for Communication. We have, together with the Ministry of Health and the other partners, developed messages, which we have even translated into the local languages. And some of the strengths that we have local community radios in every district in Uganda. And through those radios, we have put messages, we are communicating, and the support and the trust of the people is increasing because they have seen their own people die, because so far we have confirmed the 54 cases confirmed of Ebola, and we have lost 19. People have seen that the Ebola outbreak is real. They have lost their relatives, people they know, and they are responding positively. And we are going to contain this outbreak.
Thank you very much, Mr. Information Minister Chris Baryomunsi. A reminder that you're listening